Hi, my name is Angela, and I'm going to talk to you today about PICC lines, some general maintenance on it, reasons why you would need a PICC line, and just some general things to look for, like infections or whatever, so that you can be aware of them and be able to properly care for your PICC line. So a PICC line is a peripherally inserted central catheter. It's a very small, thin, flexible catheter that goes into your arm and rests right outside your heart. There's many reasons why you would need a PICC line. You can need it for long-term antibiotics that you need for like 4 to 6 weeks. You can also use it if you get a lot of blood draws or need frequent blood transfusions. Another reason would be if you need to have nutrition through an IV, or it's called TPN, or total parental nutrition, because you're not able to eat. PICC line's a great way to make sure that you get the nutrients that you need. And things like that, like the antibiotics that are super strong that you would need a PICC line for, the antibiotics are strong, very irritating to the skin and the vein, so a PICC line kind of helps bypass that vein but gets it into your body where it needs to be and allow you to get over that infection that you may have. Same way with blood draws or frequent blood transfusions. If you get a lot of those because you're chronically anemic or have a low blood count or iron levels, so you would need to get frequent blood draws or transfusions, that's a nice way so you're not having to get stuck a lot and all the time, for blood work, and then you have to get an IV to get the blood transfusion. It's just kind of very nice just to have it all here in one access. Another reason you would need a PICC line would be because you have very small, fragile veins, and it's very difficult to get an IV in you. So if you would just have a PICC line, it takes the guessing or the poking and the probing that a nurse would have to do to try to get that line in you. So some maintenance that you need to know about is that you want to always look at your dressing every day. It's a transparent dressing, so it's clear so you can see it. You can see the insertion site, which is where it goes into your skin, and you want to look at from the insertion site down to the end of the ports. You want to look at it every day. Make sure that you don't have any signs of infection, which includes redness, swelling, any warmth to it, and any type of drainage. Like, you should not have any of that. So if you would start to notice a little bit of redness here at the insertion site, you might want to call your doctor and just let them know, like, hey, I'm having some redness around this site, I don't have any drainage, and they'll ask you questions and, to help you figure out, like, do you have a starch bin infection or is it just an irritation? So it's very important that you know what to look for and call the doctor. So when you do that, they also want to make sure that this site is clean, and your dressing can stay on for 7 days. So then about once a week you need to have the dressing change. You can be taught how to take it and do the dressing change, or you can have the nurse at the hospital when you go to get your infusions done do that dressing change for you. But it's every 7 days, unless it becomes soiled, it becomes wet, then you need to remove it, do the cath care on it, like cleaning the insertion site, cleaning the area around it, cleaning your catheter to make sure that it's maintained. And a lot of times your insurance company will give you a packet that has everything in there that you need to do your dressing change sterilely. Sterile means as clean as possible, so you want to make sure that you wear sterile gloves and a mask, and which is all in here. Another thing you need to look for is where it lies in your skin, because when they put it in, it's going to have some markings on it, and they're going to tell you that it's at mark 26 centimeters, and that's an important number to remember, because if your PICC starts pulling out a little bit and it comes out more than 2 inches or 5 centimeters, you need to call your doctor immediately, because the PICC line may not be where it is supposed to be. So you really shouldn't be getting your antibiotics till you know for sure that it's still there where it needs to be and that it's safe to do that. So another thing is too, the nurses will teach you, or you can have the nurses do it for you whenever you're in the hospital, but home health nurses can teach you as well. And they can come in and do this, but you want to make sure that you flush these lines with normal saline at least once a day. But if you would get blood drawn or an antibiotic, you're going to have it more often, because you're going to flush the line before your antibiotic. You're going to get your antibiotic that you need, and then they're going to flush it again with some normal saline. And then whenever you're all finished with that at the end of the night, or if it's twice a day, and then the second dose, when you're done, you're going to get heparin put into that line. And heparin's an anticoagulant, so which means that it allows the blood to remain sticky and not clot off and cause problems with your PICC line. Now, if you only get your antibiotic once a day, then you would get it flushed, the antibiotic, you would flush again with normal saline, and then they would just put the heparin in there. The heparin does not go into your body, it just remains in the line just to make sure that the blood does not clot and remain sticky, so your line's still maintained. You can shower with this. They only ask that you put a dressing over it, like saran wrap or a bag with some tape, just to make sure that you keep this dry. You don't want to get in a pool or a hot tub or anything and submerge this line into water, because you're going to get water underneath the dressing, and that's going to allow it to get bacteria to grow, and that's going to follow your line up into your body. So that's why it's also very important that every day that you look at your site to make sure that there's no infections. Dressing changes, again, need to be done every 7 days, or sooner as needed. If you would have any type of signs of infection, like we previously discussed, you need to call your family doctor immediately and let them know what's going on, so they can make sure that we can take care of that infection. But if you would happen to have sudden chest pain or discomfort, any shortness of breath, when you have this PICC line, you need to go to the emergency room immediately, because that is a medical emergency. Another reason you would want to go to the ER is if this PICC line pulls out or it breaks off somewhere between on the ends down here in the cords or up by your insertion site. You need to go to the ER immediately, because you need to have that taken, that PICC line surgically removed, and then another one replaced. Another important thing to remember when you have a PICC line is that you don't have your blood pressure taken in this arm, and try to avoid any type of trauma. Doing that so is because the blood pressure or any type of trauma could crush this or cause it to break off, and then again you would have to have it surgically removed and another one placed. So it's very important that you remember these few steps. And again, if you have any questions, like your nurse that comes in to see you every day, or the nurse that you deal with your transfusions, can answer any type of questions that you may have. So don't be afraid to ask. That's what they're there for. They will be more than happy to help you understand it and how to properly care for this. So I hope that this was educational, and I thank you.